Too much stability is possible and it's not a good thing. Flat feet causing low back pain. You cannot build an arch through exercises in that type of flat foot. You need to strengthen your foot. And the goal of strengthening the foot is not to see a visible shift in the arch. That would also be a huge takeaway. I can actually identify and tell which children have ligament laxity by around 2 to 3 years old. Hello and welcome to another episode of Root to Rise. My name is Dr. Emily Splichal, your host, and today we are going down, all the way down to your feet. And we are talking about different types of feet, specifically flat feet. Now, what does it mean when you have a flat foot, and what are the different types of flat feet? What do you do? Can you reverse them? How do you strengthen the feet? And essentially, how does a flat foot affect movement, strength, and of course, longevity? This is going to be a great topic. It is one that I get asked about all the time. And yes, we're going to talk about children as well and how flat feet can affect our children. So the way that I want to kick this off and set the tone is that not all flat feet are the same. And actually, we shouldn't even be calling them flat feet because it doesn't tell you anything. We want to get very specific about our foot type, the different types of instability we can see in the feet, and how does it affect the chain upward. So again, not all flat feet are created equal, and it really doesn't even need to be called a flat foot. The word that we should be using when it relates to our foot and a sense of a instability or an unlocking of the foot is another word you may be familiar with, and that is pronation. Now, pronation, I'm sure you've heard this on the internet or Instagram. Pronation's not a bad thing, and it's not a bad thing. But when you overly pronate, that's what we're talking about. Now, if you have no idea what I'm talking about, what, right? I'm going to set the tone with what that pronation is, what's the opposite movement, how are our feet supposed to move. So when we understand a deviation away from that, today we're talking specifically on the pronation side, what does that mean? So let's get started with the two key words that relate to the foot and foot movements: pronation and supination. If you are not driving, you're at home, you're somewhere where you can stand up, I would invite you to stand up, of course, take off your shoes and socks, and you are going to stand with your feet shoulder width apart. And as you stand there with your feet shoulder width apart, I want you to exaggerate and roll to the outside of your foot. And then let's exaggerate and roll to the inside of the foot. And then you'll go back to the outside and to the inside. And if you're driving, you could almost visualize that you are doing this. And every time you move to the outside of the foot, I want you to hold there for a moment. We are going to call that position supination. And then let's roll to the inside. Imagine a foot collapsing and rolling towards the inside. That we're going to call pronation. And then this movement back and forth from supination to pronation is what happens in your foot with every single step you take. Now, have a seat. If you stood up, what I'm going to do is put some meaning behind these words. Supination, which is, again, rolling to the outside of the foot, creates a simultaneous lifting of the arch. So as you roll to the outside of the foot, your arch lifts, and essentially your foot becomes stable. So supination is going to equate with higher arch equal stable foot. That's what I just want you to think about that right now. As we roll to the inside of our foot, you are essentially dropping the arch and creating an unstable foot position. Pronation, dropped arch equals unstable foot. Supination, high arch, stable foot. And then we essentially go back and forth between supination, pronation, or lifting the arch, dropping the arch, or stable, unstable. And that's how you are essentially articulating with the ground, absorbing the energy from every step that you take. That's how you store energy, or you potentiate energy and you release energy. This is just the dynamics of human movement. Supination and pronation and the back and forth movement of that is completely normal. Now, where this starts to deviate is where you become too extreme. I like to think about your foot function kind of like a seesaw or like a legal scale, right? And we go back and forth on the seesaw, or the scale is tilting one way versus the other. And when we supinate, we're going to start to go on one side of the tilt, and then when we pronate, we go on the other side. And we want to go back and forth in this small degree of movement. If I tilt the seesaw or the scale too far in the direction of supination, I'm essentially becoming too stable. Yes, too much stability is possible, and it's not a good thing. When you become too stable or overly supinated, your foot becomes very rigid. It's like it's stuck and locked. Or we could tilt the scale over here, and we tilt too far into the unlocked or overpronated position, which means now you have a lot of mobility and instability in your foot. So it is the extremes on this scale, which is where we start to see pathology. So it's not just pronation is bad. I'm not saying that. Pronation is not bad. That's like saying hip flexion is bad or internal rotation of the shoulder is bad. It's not. Overpronation, uncontrolled pronation, the inability to decelerate pronation, that is all where you start to see pathology. And I'm still not going to use the word bad. It's just where you see pathology. So in the case of flat feet, really what we're talking about is an overpronated foot, a foot whose foot type has essentially tilted the scale too far over, that they now have too much laxity or too much instability in the foot. Now, to further understand the impact of this is I want you to understand the timing of how this works. So let's go back to our seesaw. And remember, as we take every single step, we go a little supinate, we go a little pronate, we go back and forth in this small movement. Why we keep it within a narrow range of movement, a few degrees here, a few degrees here, a few degrees, is because it has to do with timing. To go from supination to pronation has to happen very, very quickly in the foot. It's quick, right? Has to do with timing. When someone deviates way too far over, they tilt their scale way over into that over supinated, or they tilt their scale way over into the over pronated, they don't have time to get back to the other side. That's the way that I want you to think about it. So it's a timing thing. We keep our foot in this small range of motion so we can have the time to go back to the other movement. Overly pronated feet don't have time to stabilize fast enough when they are walking, running, jumping. And therefore, that's where we start to see the pathology. Okay, so flat foot is going to mean overpronated. We have a dropped arch. Okay, so we've defined this pronation. Now, the elements of pronation that I want to take a little bit further has to do with what happens a little bit higher up, because this will help you appreciate the impact of our feet on our knees, our hips, our lower back, all the way to the shoulder, the neck, the jaw, all the way up. Okay, now, if you, again, are not driving, you can stand up again. I want you to feel these movements. When I teach my patients, when I teach workshops, teaching professionals, I really want them to feel it because it locks it in and you can experience it within your own body. So let's stand up again. If you can, feet shoulder width apart, or if you want to just kind of visualize the movement. And if we go back to moving our foot to the inside and to the outside. So exaggerate rolling to the inside of your feet, exaggerate rolling to the outside of your feet. We now know that's supination, pronation. Do that a few times. And as you do it, Can you feel or almost imagine what is happening to your knees as you do this? Do you feel that as you collapse in, roll in to the inside of your foot, that your knees are coming together, your knees are knocking? And then if we roll to the outside of our foot, your knees move further away from each other. Roll back to the inside of your foot, your knees come together. Roll to the outside of your foot, your knees move further apart. What is happening here and what we're feeling or experiencing or describing is rotation within your legs. Your foot and every movement your foot does creates a rotation up the rest of your leg into your pelvis. So let's actually stay where we are and let's put our hands on our hips, on our pelvis. Put them on the side of your pelvis and then do that again. Roll to the inside, roll to the outside. And as you move your foot, again, we're feeling the rotation up our leg. And now that your hands are on your pelvis, do you feel that your pelvis is moving as well? Every time we roll to the inside of our foot, our knees come together and your pelvis starts to roll forward. As you roll to the outside of your foot, your knees move further away and your pelvis starts to tuck under. This is called joint coupling, and it helps you to understand the impact, the functional impact of flat feet or different foot types on the rest of the body. Since we're talking about flat feet here or overpronation, I want to really emphasize that so we understand what's happening. But if we collapse to the inside of the foot, we start to get our knees that come together. That's actually called knee valgus. That's a valgus internal rotation of your knee. You start to feel your pelvis move forward. That's called an anterior tilt. So if we were to stand in that position, that is actually called a lower crossed syndrome. Lower crossed syndrome is foot overpronation, leg internal rotation, knee valgus, so knees together, anterior tilt of the pelvis. That is called a lower crossed syndrome. If that is your foot type and that is how you stand, that is demonstrating a unlocked, unstable foundation, which is affecting your legs, your knees, your hips, your lower back, your pelvis, and everything that sits on top of it. That's how you can start to talk about flat feet causing knee pain, flat feet causing low back pain, flat feet causing sciatica. All of these things are connected based off of that joint coupling that we just described. I just want you to appreciate that so that we can take ownership of these movements in our body. And then I truly feel that when you understand the way that the body works, you are more invested in making healthy decisions, in trying to strengthen the body, to work out, to use devices that support the foot, whatever it is, but you are essentially invested in this process. Okay, so that's the way that your foot works. Okay, that's the way that flat feet can start to affect the body. So the way that I want to now break this down, because there's a way that we can get very, very specific on this, has to do with different types of flat feet. Now, the way that I break down flat feet, overpronated feet, again, we're not using the word flat feet, but I might say that a few more times. But when I am presented with a patient who has low arches, okay, overpronated feet, not that high supinated foot, I am starting to create a map in my mind as far as how I'm going to classify it. Because again, not all flat feet are the same. Not all flat feet are created equal. We have to start to differentiate them. So that differentiation helps me help you even more. I can't give the same formula or prescription to every flat foot that walks into my office because it's not how it works. They're all very, very different. Okay, so the way that we're going to start this is by first breaking it down into, is it flexible or is it rigid? Okay, if you are listening and you have flat feet, are your flat feet rigid or flexible? The way that we start to differentiate this has to do with what happens to your foot when you have no body weight on it, which is called open chain, and then you stand on your feet, put body weight or closed chain. Non-weight bearing, weight bearing. If you are sitting with your feet extended out, no body weight on your feet, and you look down at your foot and you see a beautiful arch, and then as soon as you stand up and you put body weight on your feet and your feet go boom, and they collapse down, that is going to be flexible. That is a flexible flat foot. And what that's telling me is that you have arch potential. You have the potential ability and the flexibility to create or to shape or to control the arch in your foot. The opposite of that is going to be rigid. A rigid flat foot is one that non-weight bearing open chain, sitting in a chair, feet extended, you can see from across the room that these are big old pancake feet. There is no arch in those feet. And then obviously, if you have no arch, non-weight bearing, as soon as you stand in your weight bearing, you're not going to have an arch, okay? So that is a rigid flat foot. That is a rigid foot. No movement of that arch is happening. There's no potential to create an arch in a foot that has no arch when it is non-weight bearing. Very, very important distinction. Okay. Now, between those two, flexible or rigid, that's your first kind of breakdown in this chart. We are going to start by talking about flexible because that's the most common that I see. That would be the most prevalent. I see a lot of rigid flat feet, but the majority of who's listening to this podcast right now is going to fall under the flexible. Or if you're a professional and you work with clients and athletes and patients, most likely you're going to be over here navigating the flexible flat foot. So let's break that down even more. There are two most common causes of a flexible flat foot. The first one is muscle weakness. The second one is going to be ligament laxity. This is a very important distinction because guess what? One of the most common myths that I hear is that all flat feet can be strengthened. Your foot is flat because it's weak. Well, that's not true always, right? We also have a ligament lax foot. And that ligament laxity is oftentimes genetic, or it is a sequelae of moving on a flexible flat foot for too long, and then we've essentially torn certain ligaments. But that's over here. You cannot reverse certain components of laxity. But let's create that distinction. So we are going to start with the muscle weakness. So we got a flexible flat foot that we've determined is muscle weakness. What are we going to do about this? So with this one, the way that you observe this and can differentiate this from ligament laxity is that muscle weakness in a flexible flat foot is primarily held in a joint called the subtalar joint, but this is your calcaneus. So it is just your heel bone rotating into a little bit of eversion. So we typically see it in the back of the foot. Real quick, just so this is very clear for everyone, if we jump real quick back over to the ligament lax one, the ligament lax flat foot is going to have the falling heel, but it is like the whole arch just spilled into the inside of the body. It's like the whole foot just dropped into the middle. That is laxity. That is midfoot. That's your arch in the middle of the foot. That's over here. When we think muscle weakness, we're just looking at a little bit of an unlocking in the rear foot. So this is where someone may say, well, my heel is collapsing, but I swear it still looks like I have an arch. It might be a lower arch, but I still have an arch. That's where I start thinking about muscle weakness. Okay, so that sounds familiar. That's where you could start to be thinking. Now, our goal on the muscle weakness side is to go after the intrinsics. You have 26 muscles in the bottom of the foot, and it is to go after your posterior tibialis, which is a muscle on the inside of the foot, and your glutes. Yes, your glutes can actually control your arch height and your foot type. I will give glute strengthening to every single one of my muscle weakness, flexible, flat feet patients. Okay. Now for this, again, you're thinking muscle weakness, slight drop of the heel and unlocking of the rear foot, creating a internal rotation of the lower leg. Maybe the knees are going a little bit valgus. Maybe you've got a little anterior tilt. First thing on this, how to strengthen your foot. The way that I strengthen the foot, your step one always has to be finding proper alignment. Because what benefit does doing foot exercises with poor alignment do to your feet? This is like doing bicep curls with poor posture and you're just doing bicep curls. No, we always first step one before any exercise that you do, I don't care what part of the body you are exercising, you achieve alignment first, then you execute the exercise. So in your foot, it's not going to be just a foot, but in your foot or starting with your foot, you are going to lift your toes and find your foot tripod. Spread your toes as wide as you can, place them back down onto the floor, and then keeping your toes on the floor, I want you to externally rotate your hips. You're going to, this is essentially like squeezing your glutes. You're going to rotate that hip out, which is like squeezing your glutes, and you should feel your arch lift or engage. From here, you are going to take your rib cage and you are going to stack it with your pelvis. So think of your rib cage as a cylinder and your pelvis as a cylinder, and you are stacking the cylinders. And then I like to keep nice neutral head alignment. At this time, you can very much make sure that your tongue is resting on your palate behind your front teeth. So you always want to be aware of the tongue position in the story. So that is a stacked position. Again, real quick as a recap, foot tripod, first, fifth, heel, spread the toes as wide as you can. If you have bunions and hammer toes, I would throw on some toe spacers. You would then externally rotate your hips to lift that arch, stack your rib cage and your pelvis, stack those cylinders, and then bring your tongue to your palate, and you're thinking string lifting up. You are now stacked. From here, you are going to progress into short foot is really the most common exercise, but I like to start short foot with an exercise called forward lean. You will stay exactly in that alignment that you have. And staying in that alignment, you are going to imagine that you are stiff as a board. Stay stiff as a board, and ever so slightly, you're going to lean your body forward. You can almost think of this like you are a tree swaying in the wind. That's how I like to think of it as well. Okay, so you are a tree, think of the tree trunk, and you're ever so slightly leaning forward and back to neutral. Every time you lean forward, you will feel your toes activate or anchor into the ground, and then we bring it back. Slight lean, your toes anchor, bring it back. Okay, I like to do 5 to 8 forward leans, nice and easy. And then on that 8th one, you're going to stand nice and tall, stay exactly stacked as we did in the beginning. And now you are going to push your toes into the ground without a lean. And as you push your toes into the ground, you are going to exhale your breath. And then you will relax and inhale the breath, relax your feet. Exhale the breath, push your toes down into the ground. And then relax the breath, inhale, relax your feet. And you're doing that for 5 repetitions. From here, I like to transfer into a single leg stance. So from here, you are going to start to exhale. Push your toes down on your feet, just like you did. Shift your weight to your right leg and then bring your left leg up so you are balancing on one leg. Your breath is continuing the entire time. When you run out of that exhale, you will put both feet down and inhale. Start to exhale, push your toes down again, shift your weight to your left leg, bring the right leg up. So now you're balancing just on your left side, and you're going to continue exhaling until you run out of the exhale. And then inhale back down, and you're essentially repeating. And I like to do that 3 times each. From here, you're going to grab like a lacrosse ball, a Nero ball, something like that. And you're going to place the ball between your heels. So you're standing with your feet close together. Put the ball between your heels. And what you're going to do is you're going to slightly lift your heels and squeeze the ball together between the heels. Keep squeezing the ball between the heels, and you're going to lift all the way up into a calf raise. You're going to go up as high as you can in that calf raise, and then you're going to lower back down. I always like to relax at the bottom and then start again. So you would relax, slight lift of the heels, drive your heels into the ball, lift, 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 all the way into that beautiful calf raise, and then lower all the way back down, place the ball back down. And I like to do that 10 times. Now, what you're doing here is that you are strengthening the posterior tibialis, which is a muscle in your lower leg that is responsible for lifting the arch. That's what that muscle's job is. So by doing the ball between the heel calf raise, you are strengthening the posterior tibialis. From here, I would love to extend into more advanced single leg exercises. This is where the Novoso-Kinesis board is great because we're going to be strengthening the post-tib and the intrinsics all the way up the hip into your glutes. So I would do a few exercises on that. And then I would throw in some single leg exercises really targeted at the glutes. I love reverse lunges. I love bowler squat where you bring one leg behind. I love a rotational lunge. I guess sometimes a bowler squat's called a curtsy squat. I like a rotational lunge. I love single leg deadlifts. I love single leg squats. I love step ups. So anything that is single leg based, you are focused on your foot, on your core, and on your glutes. That is going to be how you want to strengthen the flat foot that is flat because of muscle weakness. And then I recommend that programming. Realistically, I incorporate that into, let's say if you're bringing stability to the foot post plantar fasciitis and you're trying to regain the strength of a foot before you get back into your normal regimen, then you can do a little series every single day, and I'll have people do a little 10-minute foot strengthening. You cannot over fatigue these muscles because we use them every single day. So to do a 10-minute foot strengthening series every single day, that's not inappropriate, knowing that your lower extremity muscles are used every day, almost all day, right? They're your locomotion muscles. So they are built for endurance. So I like to think of this as an endurance-based strengthening, also really good in the morning or the beginning of the day to really activate these muscles, or the beginning of a workout. Then long-term, how you want to think about this is you would do these series of exercises before you do the rest of your training. If you are an athlete, you're doing this before you hit the court, hit the field, whatever it is, you're priming the system and you're essentially incorporating it. Remember to always, always incorporate your breath in this. Every time your toes go down, you should be exhaling. Okay, you want to be exhaling. So that is going to be your foot strengthening for a flexible flat foot, secondary to muscle weakness. Now let's go to the other one. Flexible flat foot due to a ligament laxity. Again, this is the one that it looks like the whole arch just spilled and dropped to the inside of the body, like a dumping or an unlocking of the whole midfoot. They're typically the ones that look the most obvious. If you go on like Google Images and you're like flat foot, you can see a lot of just the foot dumping towards the inside. That's a ligament laxity. That's not a foot that you can strengthen away. You cannot build an arch through exercises in that type of flat foot. That is such an important misconception that I want to clarify, because I get patients who have that foot type. And I remember having this one patient who diligently strengthened their foot for a year. Like they were dedicated for a year doing their foot exercises. And then they came to me and they're like, I've been doing this for a year. Like, am I doing the wrong exercises? And I was like, oh, you have a ligament lax foot. You will never build an arch in that foot. So Doesn't mean you shouldn't do foot exercises. I'm not saying that, but the reality of the shape of the foot, of what we're trying to achieve, that part is really important, okay? So in a ligament lax foot type, you have this unlocking of the midfoot, kind of this bulging of your midfoot towards the inside. Oftentimes there's bunions that present with it because of a laxity in your metacuneiform joint. If you have a ligament laxity there, the first metatarsal can swing out. So you absolutely could have that as well. But this presentation, again, we are not strengthening the arch back. We are looking at finding or using external support. Now, you don't have to use external support in a ligament lax foot. However, in a symptomatic ligament lax foot, this is where I start thinking about support, because a ligament lax midfoot foot is very unstable and just doesn't have the time to stabilize, and it's starting to stress the joints and the ligaments, and they keep getting post-tib tendinitis, and they keep getting plantar fasciitis, and they injure their knee, and they are, a high-level high school or collegiate athlete, and they're fatiguing faster than their peers, right? So a lot of this has to do with our foundation, where you may start thinking, well, what's the role of incorporating support into my shoes while still balancing it with foot exercises to keep that strength, okay? So for this is based around orthotics, where we may want to look at arch supports or orthotics. Now, there's different degrees of support that you can bring into a shoe. I will start with the most conservative and then the most aggressive over here. So the most conservative would be, I would say actually even before a foot pad. I was going to mention certain foot pads, but you could even do a heel toe drop. So essentially using a shoe that has a heel toe drop puts the ankle in a plantar flexed position, which theoretically inverts or supinates the foot to slightly lift the arch. So using shoes with a slight heel makes a foot more stable. Great. That could be one option. It's very, very conservative, but just know it exists. Then in line would be using foot pads to build up the shoe itself, or the cleat. This is good for skates, cleats, maybe certain shoes where it's difficult to fit some of these more aggressive foot support into them. Here you would get a pad that's called a scaphoid pad. Scaphoid pad or LA pad, they're essentially interchangeable for the sake of this conversation. A scaphoid pad or an LA pad, like Los Angeles, LA pad. These are felt pads. You only want to get felt pads that are put in the shoe, in the cleat, whatever the footwear is, to build up the arch and to essentially lift the bones of the midfoot up. If you are going to try this, I would recommend getting a felt pad from Hapad, H-A-P-A-D. Hapad are these foot pads, Hapad, and you lift the arch up, and then you can add another one in the back, which is called a post. So it's a rear foot post, a heel wedge, or a varus post. So one of those is essentially what you're searching. But again, I would get it from Hapad, hapad.com. They have very, very good high quality pads. Of course, you can get them on Amazon. If you look for them on Amazon, then definitely make sure you are getting quarter-inch felt always. Nothing thinner. Don't do silicone. Don't do foam. Okay? So you are building the shoe up and bringing the support to the parts of the foot that we need. If you want to go a little bit more aggressive, this would be an over-the-counter arch support. This would be something like the Naboso form. At Naboso, we have an arch support with our texture on it, so you keep the foot activated while being in that support. That's an awesome option. Power Step is another one that I like. They also have 3/4 length, so they have shorter insoles for certain shoes like cleats and things like that. So very much like that. A little bit more aggressive to that would be the custom, a custom orthotic. Custom orthotics, when I make these for patients, I can also vary the degree of support that I'm putting in it. I could do a mild foot support depending on the belief of the patient and where they want to go with it, or the shoes that they're going to put it in, or I could be very aggressive if they're open to it, if they need it, if they're symptomatic, if their footwear allows it. You can go very, very, very supportive, where you're using things like phalanges, which is a wall that just holds that foot up. It's like a wall that the foot can't push through and drop down into that overpronated position. So it depends on there, okay? Now, regardless of that arch support, whether it's the pad, it's the over-the-counter, it's the Naboso form, it is the custom orthotic, you are still doing foot exercises. So whatever I mentioned in the beginning for the muscle strength flat foot, you are doing those exact same exercises for the ligament lax foot. However, this time you want to make sure that you are doing those exercises either barefoot, and you have to hold your foot in the position that it needs. If you cannot hold your foot in that position because of the laxity, which is very common, then I recommend checking out the foot wedges from Naboso. These are wedges, 10-degree wedges, 25-degree wedges, and you essentially prop your foot up into a neutral position so then you can focus on the exercise. Otherwise, if you don't focus on keeping your foot and you focus on the exercise, your foot's going to collapse right back down. And then you're not getting the benefit of what we need. The other option, instead of doing it barefoot with the Naboso wedges, is to do it in your shoes with some of this support that we just discussed. But it's all about alignment. Regardless of your flat foot type, you are achieving proper alignment first, and then you put the exercise on top of the alignment. Okay, same exercises. I would recommend it in the same way with everyone. There's one last thing that you can do for the ligament lax foot, especially if it's symptomatic, it's flared up, it has a post-tib tendonitis, it has a tarsal tunnel. There is a brace called an ASO brace. You can find these on Amazon. It is a lace-up brace, and you essentially tie it all the way up. I kind of think of it almost like a corset for the foot. And you put these straps across, and it's going to lock your ankle and your rear foot. In extreme cases, I will recommend that to patients. I've had patients who have had a ligament lax foot, a post-tib flare-up. They calm it down, but then they're going to go on a ridiculous hiking competition or trip, whatever they're doing. So I know that they're going onto this very unstable environment that is definitely going to stress their foot, and they just got over this injury and they're in a recovered state, but they still have their ligament lax foot. I will tell them preemptively or preventively to use an ASO brace when they do the hike. So that's a way that you could think of that as well. Okay. So let's now go into the other foot type. So this is the flexible one. Flexible flat feet, there's two main causes: muscle weakness, ligament laxity. And of course, you could have a combination of both. On the other side, the rigid, this is the one, remember, where you look at it open chain, no arch, standing up, still no arch, right? So the bones are essentially just fused flat. Now, there's two main causes or types of this as well. The first one is going to be that you are rigid in an overpronated position. So you are rigid and stuck and fused with your foot collapsing in, and the internal rotation of the leg and the knocking of the knees and the anterior tilt to the pelvis. All of that is essentially built off of this rigid, stuck foot. So it's rigidly overpronated. Okay. Why I emphasize that is because there's a rotational impact on the rest of the body. This can be very hard on a person's ankles. It can definitely lead to ankle arthritis. It's very hard on someone's knees. It could lead to knee arthritis, very hard on the hips, the lower back. So that arthritis or that structural rigidity definitely affects the skeleton all the way up. So that's a rigid overpronated. The other rigid type is a rigid pancake. And this is not a formal diagnosis. This is my word of using it. But it is a foot that's not rolling in and collapsing to make the flat foot. It is essentially just flat. There's no rotation. It is just a pancake. All the bones are parallel to the ground. And that I see a lot. It's a genetic foot type. You will see this in certain populations, that it is a wide, flat pancake foot. And that's just how we'll describe it. And why that's important to note is because there's not a lot of play in these feet. And if there's no play in the feet because of the rigidity, I can't recommend stiff custom orthotics to a patient like that. If someone has a rigid, overpronated foot that is stuck down and collapsed, they will not tolerate a hard, plastic, stiff custom orthotic. Why would I sell a $1,000 orthotic to them, right? It's one of the biggest misconceptions that I see out there. And honestly, a frustration, because I get the patient who comes in with multiple pairs of custom orthotics that they paid for and say they all hurt my feet. And then I look at their feet and they fall under this rigid flat foot type. Well, no wonder, right? It's not appropriate. So on this, what I want to talk about first is the rigid overpronated. So the rigid overpronated is a sequelae of the flexible overpronated. So normally I will see the rigid overpronated foot in someone who is a little bit older, 70s, 80s, 90s, kind of like that. And they had a flexible ligament lax foot their entire life, but for years they just moved through that unstable foot without sufficient strength and alignment, that they just started to wear the joints down, and then eventually the joints wore down to the point that the body fused them to minimize the pain, and now they have a rigid, overpronated foot. So just that's the sequelae of where that could go. The rigid pancake one, that was essentially genetic. They were born with it. That's not a sequelae of something. It's not a pancake foot because the arch is weak. Okay. Now, for this, whether it is a rigid overpronated, a rigid pancake, the way that we are thinking about this is a term that is called accommodative. Accommodative means that we are essentially trying to just distribute pressure a little bit more evenly across the foot. There is a type of insole that I recommend for these individuals, and it's called Plastazote. You can find this on Amazon. Plastazote, Plastazote, Plastazote is actually a trademarked material, and that material is like a peachy color. Plastazote is like memory foam, sophisticated memory foam for your feet. And it redistributes pressure away from any of these hot spots, because if you have a rigid flat foot in any way, there's a lot of bones that start to become very prominent, and it can be very painful. These feet are very, very painful. Painful on the bottom because it's like they're walking on their knuckles. Painful in the middle of the foot because their whole midfoot is just fused and stuck. Painful into the ankle, and then obviously the rest of the way up. So we want to accommodate them with this Plastazote material or a memory foam material. You can build these into custom orthotics. So yes, you could extend them and add Plastazote to something with a very, very mild arch. Maybe that's for the pancake foot that has mild movement still. You could look at that. And then guess what? In addition to that Plastazote insole or that memory foam insole, we are still doing our exercises. But this time, the goal of the exercise is not to change the arch of the foot. We're not trying to build an arch in the foot. Even if you have a rigid flat foot or a pancake foot, your foot still needs to connect to your pelvic floor. Your intrinsic muscles still have to connect to your pelvic floor, to your diaphragm, to your tongue, because that's how you talk to gravity. That's how you maintain stability from the ground up or from a foot to core perspective. So rigid feet still need to be strong feet. We need to do those exercises. We need to keep the toes mobile and activated. So I think actually the biggest takeaway here is, regardless of your flat foot type, flexible, rigid, weak, ligament lax, pancake foot, whatever it is, you need to strengthen your foot. And the goal of strengthening the foot is not to see a visible shift in the arch. That would also be a huge takeaway. Your goal when you strengthen your foot, regardless of your foot type, is to not change the actual morphology of it. You're not going to do these huge movements and changes in the foot. Because what's really interesting, in the foot, when you see foot changes, like let's say I use an orthotic and I'm going to create stability of the foot. My correction with a custom orthotic in the heel, on average, is 2 degrees. That's it. So we're not looking for like a 30-degree shift or 5 millimeters or a centimeter lift of your arch. Like, that's not how the foot works. Everything is micro. Everything is small. The blood vessels, the fascia, the nerves, everything is small. So 1 degree, 1 millimeter of a change in your foot is huge to the impact on the rest of the body. And that is very important to understand and appreciate. Okay, so last thing that I want to mention here before we wrap up has to do with the kiddos. Flat feet in kids. Here's a few things. This will be my rapid fire flat feet children segment. Is first one, all children are born with laxity and lots of fat in their feet, primarily cartilage. They actually have very, very few bones when a baby is born. So the flatness of a baby foot, totally normal. They actually have more of a pancake shape to their foot. That is, again, from the fat and the cartilage. They do not have the bony structure yet. They actually don't have a lot of bones. And then as they start to grow and develop, they will develop their foot through the age of 7 as far as when it starts to determine what is most likely their foot type going to look like. So an adult arch is formed through the age of 7. Now, it is told by pediatricians that all children will grow out of flat feet. That is a huge misconception as well, because there are certain types of flat feet. If we go back to our chart, muscle weakness, pancake, ligament lax, I can actually identify and tell which children have ligament laxity by around 2 to 3 years old. Now, I don't do anything with the children at 2 to 3 years old because I want them to be barefoot as much as they can through the age of 4, for sure, but even longer, of course. Of course, when we go to school, then their shoes, etc. So I will try to hold off any sort of arch support or intervention for a child until, for sure, at least 4 or 5 years old. Do they make orthotics and arch supports for toddlers, like a 3-year-old? Absolutely. I never use them in 2-year-olds. I want the child to be barefoot as much as possible. But again, that laxity you can see in a child around 2, 3, 4, 5 years old. You'll see that same kind of rolling in of the ankle, almost like the adult foot. It takes a little bit of a trained eye. So if you have questions about a child, your child, a relative's child, as far as their flat feet and are they going to grow out of it, please reach out. Virtual consultations, very easy for me to do for a child's flat foot. But when I see ligament laxity in a child, let's say a 4-year-old. I actually saw a 5-year-old last week who had this. And I explained to the parents that this laxity of the foot was genetic. That's why she's standing like this. And she actually turned out in an abducted gait. I let them understand the impact of that. That laxity foot is going to make a child a little bit more easily fatigued. They may ask to be carried more. They may trip over themselves. They may feel a little bit awkward. Let's say they're doing soccer in school or something. You know, they may trip over their feet. They may feel a little bit slower when they're running because a flatter foot, pronated foot, is an unlocked foot and it doesn't have time to stabilize fast enough. This is even in a child, right? So that's how a child will start to present. Now, if you use arch supports in the child, so in this 5-year-old, I recommended to start with an over-the-counter arch support. I recommended Power Step. Power Step has great children's over-the-counter arch supports. And what that's doing is it's creating a more ideal alignment of the foundation, making the foot a little bit more stable so it doesn't get as tired as easily. It sets the foundation through which the bones, the joints, the nerves, the tendons, the blood vessel grow through the rest of the body, especially when you're 5 years old. This is very important. And I said that that's the environment for when she's in school. When she comes home, I still want her to be barefoot all the time in the house. Take off the shoes and get that barefoot stimulation. I want barefoot play. I want her climbing. If you can put her into gymnastics and martial arts or dance or something that is based around foot awareness, foot strength, pointing, all of that, very, very good. And then I gave a few exercises that is easy for a child. One of my favorite is to release the feet on a kneel ball. Just set the little kneel ball domes down. When they brush their teeth, they stand and they release their feet. It can just be, there's just kind of plain fun, almost like it's a pebble path and they're just stepping on it. That's a great way. Put the ball between the heel. I gave this exercise earlier. Put the ball between the heel and just make it something fun for the kid to do, right? Those are probably the two biggest exercises. You could have them do balance as well. So balancing for a child is great as well. I love activity-based or play-based. So that's where I would say do the dance, do the gymnastics, do the martial arts for the child. But again, when you're thinking child, all children are born with flat feet. Not all children grow out of their flat feet. Typically, you can identify ligament laxity in a child by around 2-3 years old. Even though a parent might not bring them in sooner. I don't do interventions of arch supports until 4 or 5 years old. A child grows an adult arch through the age of 7. And yes, our arches can continue to shape and develop after that, of course. That is where we want to be thinking about our children. If you have any questions in relation to your child's flat feet, I can definitely reach out for a virtual consultation. I love doing pediatric or children-based assessments so that I can also educate the parents, because the parents play a very important role in setting the foundation of a healthy foot habit. So our job as a parent is to teach the child how to prioritize their health and to understand their foot. And last thing I'll say about the children and flat feet, because I get this a lot from parents, is if a child has a flat foot, namely ligament lax, and you use custom orthotics for, let's say, 5 years. They start custom orthotics at age 7, and your child uses them till age 12, 13, 14. Do they no longer need it? So, yes, using custom orthotics in a child does not mold the foot into an appropriate position. This is important. This is not like braces or something like that. You are not molding, holding, and trying to create alignment like the teeth to shift. Once that arch or that arch support is removed, if they have ligament laxity, that foot is going to drop. So custom orthotics in children is not a temporary shaping of the foot that once they are done growing through the age of 18 to 20, they no longer need the arch support because the foot has shaped itself to support the body. Unfortunately, that's not how it works, especially in the case of ligament laxity. But we build the strength on top of it. So as we wrap up, this episode is for all foot types, not just flat feet. However, if you do feel like you have arches that are falling, or you have a pancake foot, or you're curious of your foot type, then hopefully this helps you start to better understand your path and the realistic outcome that you can see from your exercises, arch supports, etc. If you have any questions on your foot type or you're open to a virtual consultation, please schedule that through my website, which is my name, dremilysplichal.com. Remember to focus on your foundation. Consistency is key. A small dose of foot strengthening every single day will go a very, very far way. I hope you enjoyed, you learned a lot, and I'll see you on the next episode.